As a nurse, you should always know that before doing any procedure to a patient, always start on introducing yourself and asking the patient's name to avoid getting mistaken to other patients. Today, we are going to perform bed bathing, bed making, bed restraint, and back rub. But before doing any interventions or procedure, you should do a proper hand washing and always wear gloves. Bed bath. Before starting bed bathing to the patient, let the patient feel the temperature of the water and ask the patient if the temperature is good to his touch. Next, put towel under his head, but make sure that when you lift the patient's head, always support it with your hand. Also, make sure to put another towel onto the top of his chest. This will make sure not to wet the bed and the patient's chest. Next is to wet a clean towel and wipe the patient's face with the towel. After wiping the face with wet towel, dry the face with a clean cloth. After bathing the patient's face, remove the patient's clothing. To undress the patient, first turn the patient on the side and remove the patient's clothing on that side, and do the same thing on the other side. To totally remove the clothing, lift the head of the patient and support the head while removing the whole clothing. Next step is to put another clean towel on top of the patient's chest for drying after wiping the patient's body with wet towel. Wipe the patient's torso, shoulder, and abdomen. Next is to wipe the arms and the armpits, followed by the lower limbs. Next is bed making. After bathing the patient, you should change the bed's blanket, the bedsheet, and the pillowcase. First, put a new clean blanket onto the top of the patient. Next is to ask the patient to hold the blanket and position yourself at the bottom or under the patient's foot and reach for the old blanket and roll the old blanket outward and put it in a laundry basket. After changing the blanket, next is to change the pillowcase. To remove and change the pillowcase, carefully lift the patient's head and remove the pillow while supporting the patient's head. Put down the patient's head slowly, and once settled, change the pillowcase and put it back under the patient's head while supporting it carefully. To remove the bedsheet, carefully turn the side of the patient and roll the blanket up onto the patient's back and do the same thing on the other side and remove the bedsheet. To replace it, turn the patient again on its side and put the new blanket on the bed and fold it half way to the patient's back. Turn the patient on its other side and roll down the bedsheet and soft it down with your hands. To finish, tuck in the patient's blanket. The next one is back rub. If your patient is in pain, back rubbing can help your patient to ease the level of pain. To perform back rubbing, roll the patient on its side and roll up the clothing of your patient and slowly massage the back of your patient. By doing this, it can make your patient more comfortable and feel less pain. After rubbing the patient's back, carefully assist the patient back to bed.
Before you enter to the patient room, perform hand hygiene. Introduce yourself to the patient. Ask his name to identify. Before you apply a restraint, check the healthcare provider's order. Explain to the patient and his family why his healthcare provider has prescribed the restraint. Adjust the bed and make sure the patient is comfortable. Ask the patient if he's having pain in the area where the restraint will be placed. Help the patient into a sitting position in the bed to place the belt. And place the belt over his hospital gown or pajama. Position the restraint at his waist and not over his chest. Make sure the patient is comfortable. And ask the patient to take a deep breath to assure there is no restriction to his breathing. Attach the restraint securely to the stationary part of the bed frame. Same as to the other side of the bed. Make sure the patient is comfortable. Place the foam padding to his wrist or ankle. Make sure it is snug but not tight. To check the fit, make sure you can slip 2 fingers between the restraint. Secure the strap. Tie to secure the restraint to the stationary part of the bed frame, chair, or to the wheelchair. Make sure the ties or buckles are out of the patient's reach.